Greetings, friends and neighbors, and welcome to episode 11 of the Community Solutions Podcast, coming to you from the students, faculty, staff, and community partners associated with the Department of Social and Behavioral Sciences at the Indiana University Fairbanks School of Public Health in Indianapolis, Indiana. I'm Jack Turman Jr., a faculty member in the department and your host for this podcast. Thanks for listening and for spreading the word about our podcast to your friends and neighbors. Working together, we are building healthy, hope-filled neighborhoods where residents help, serve, and respect each other. On behalf of the entire Community Solutions team, I encourage you to subscribe to, follow, rate, and review our podcast. Today, our students Nathan and Morgan converse with Ms. Lisa Hayes, Director of Women's Health Initiatives at the Gennesaret Free Clinic in Indianapolis. Ms. Hayes is a wonderful advocate for women with breast and cervical cancer. She is the Executive Director of the Red Alliance, an organization that addresses the racial disparities of breast cancer in Indianapolis. She provides us with insight as to why African American women have higher breast cancer mortality rates when compared to other races and ethnicities. She discusses the background to this disparity in Indianapolis and across the nation and gives a great example of how Chicago addressed this disparity. She shares an important wisdom, which is that communities have different needs, and we all have to take the time to understand the social and health needs of individual communities before applying a set of interventions. We must listen to women in communities across the globe, respect their assets and needs, and work together to support equity for all women to optimize their health and well-being. Let's join the conversation.
Hi, I'm Nathan.
And I'm Morgan, and we're here with Miss Lisa Hayes. Miss Hayes, welcome, and thank you for being a part of our podcast today. Let's go ahead and get started. So, Miss Hayes, tell us, what is your role as Director of Women's Health Initiatives at Gennesaret Free Clinic?
So the Women's Health Services at Gennesaret Free Clinic includes doing screenings and education related to breast and cervical cancer. And then beyond that, we assist people, our patients, with connecting them with any other follow-up services. So if they need any kind of diagnostic tests, if they need medications, if they need, referral for some other kind of services, that's part of my role as well. So I'm the only staff employee assigned to this particular program within Gennesaret, but we have partnerships and volunteers that actually do the services. I'm not a medical provider. I just coordinate all these things and then also provide all the navigation services to make sure that the patients receive all the services they need through what we refer as the continuum of care. So wherever they come in, if they come in as a first-time patient with a breast exam, I take them all the way through, even if it ends up being a diagnosis of breast cancer, I would have navigated them through all those different services.
All right. And what led to your involvement with the Red Alliance?
Well, the Red Alliance was formed several years ago, and in its formation, the people who decided to bring this Red Alliance together reached out to breast health advocates and organizations that have already existed in the city of Indianapolis and did work in the area of breast cancer. The whole point of forming the Red Alliance was to address the breast cancer mortality rate disparity for African American women in Indianapolis. So since I have been active in this advocacy and services field related to breast cancer, I was one of a group of people initially invited to a convening meeting to try to bring people together to explore what could be done about the disparity and to work in partnerships and collaboratively to make that happen. So that was my initial involvement, and as it turned out, I sort of caught the fever, I would say, and really was interested in the mission and the goals of the organization, which, I mean, it wasn't initially called the Red Alliance. That's what we came up with later on. But it became somewhat of both a professional and personal mission for me as an African-American breast cancer survivor. The fact that our mortality rate is higher in Indianapolis was significant for me. And so with my engagement with that, it's led me now to serving as the executive director of the Red Alliance.
Ms. Hayes, in your opinion, why do you believe there's such a health disparity in breast cancer screenings, time to treatment, morbidity, and mortality between African American and Caucasian women in Indianapolis?
I think it's a combination of factors. Many of those are socioeconomic factors. But there is a lot of research going on, both locally as well as across the country, because the disparity isn't just in Indianapolis. It's a disparity across the country. It's just that in different cities the numbers vary. But I think nationwide the disparity is right around 40%, which is what it is in Indianapolis as well, meaning that African American women have a 40% more likely risk of dying from breast cancer. So some of the research has shown that it's because of late-stage diagnosis, which means that, like you alluded to, that African-American women are not getting timely services. So that could be part of the problem. There's also research that maybe the types of breast cancer that African-American women are diagnosed with tend to be more aggressive or harder to treat. That might be a piece of it, but that does not explain why there might be a disparity of, say 40% in Indianapolis, but only, 10% in another city that might have a comparable population of African American women. So there are other things to look at, things like morbidity. African Americans tend to be on the negative end of all types of health conditions. So whether that be asthma or diabetes or other chronic conditions, if you have one of those conditions and then you're diagnosed with breast cancer, the treatment course might be a little more difficult, and that could lead to a higher death rate. But right now there are more questions than there are answers out there, and that's one of the reasons that the Red Alliance was formed, to try to hone in on what's happening in Indianapolis, find those reasons, then fashion solutions that will address it here in Indianapolis. I will share this too. Chicago 7 years ago, and now 8 years ago, had a higher mortality death rate than Indianapolis does currently. But they formed a coalition there to address the problem there. What they found was that a lot of their issues had to do with screening rates, where African American women were not being screened at the same rate as Caucasian women, so therefore their cancers were not being diagnosed as soon. But also a finding there that the quality of the screenings that African American women were receiving were of a lower quality than Caucasian women. So once they discovered that in Chicago, they were able to come up with solutions to address that. For instance, there was a intentional effort for African American women to get their mammograms at a higher quality location, or where they had higher quality equipment. There was a concerted effort to bring education and awareness to African American women to let them know the importance of getting a timely mammogram. So the efforts there has led to a decrease in their mortality rate there. So in Indianapolis, what we do know is that the screening rate is not an issue, because African American women are screened at about the same rate as Caucasian women. So what worked in Chicago is not necessarily going to work in Indianapolis. So again, it goes back to finding out the reasons going on here, and then try to address those.
And what are some programs that Red Alliance does to combat these disparities?
Well, so far we're doing things kind of based on anecdotal information, because we haven't been around and done enough research yet to find out conclusively if there are like delays in getting diagnostic services or delays in starting treatment. Now, anecdotally, we know that happens sometimes. I know that from my own work with Gennesaret. when I first started out with Gennesaret, our program was primarily targeting getting screening mammograms, and we didn't really have a program for to provide diagnostic services. We really relied on, once we knew a woman needed a diagnostic service, then we were looking at other organizations, health systems, and agencies to provide those services, which that's sort of a built-in delay, because you got to make the phone calls, and you have to make sure that a particular woman is eligible for the services being provided. There were at that time more limited services for diagnostic services for someone who was uninsured or could not otherwise afford to get those services. So in my early years with Gennesaret, I saw a lot of those delays where someone might have a screening mammogram that was abnormal, but it would be another 2 months, 3 months before they could get their diagnostic service, just trying to get them to a place where they could get to where it was affordable and those kinds of things. So one of the things that we did at Gennesaret was to seek out partnerships with other organizations that could partner with us to provide those diagnostic services for our patients, and also sought out funding to cover that, because that's usually the issue is the funding. So once we put those programs in place, we were able to cut down the time between an abnormal screening and having diagnostic services to less than 30 days. But that's just for Gennesaret. But we know that's happening all over the city. And so for other, if a woman goes to a clinic outside Gennesaret, we don't know for sure how quickly that's happening. So that's one of the research projects that we've been proposing. Like I said, right now it's just been talking to women about what their experience has been. But we have a proposal out there that we're trying to get funding for, to actually pull data from different hospital systems and organizations that provide mammography services to kind of track what the timelines are. So then if we find that there are some significant disparities between the timeline for African American women and Caucasian women, well, then that tells us that's where we need to do the work. And maybe it's that we need to implement more programs similar to what Gennesaret has, to kind of catch those women and make sure they're getting timely services. But on the kind of layering on top of that always is the education and awareness piece. So part of what the Red Alliance does is provide education and awareness to individual women or groups of women to reinforce that, yes, it's important to get your mammogram, but it's also important, if you are recommended for a follow-up, to do that timely and to know where those resources are to get those. To reinforce that being called back for additional images after a mammogram is not necessarily a death sentence. It's sometimes just to get clearer pictures. But it could lead to a diagnosis, but the thing to know and understand is that the earlier you're diagnosed, the better your chance of a successful treatment. So it's those kind of educational messages that we try to share with women. And so we kind of call that their personal responsibility or accountability, whereas what we're doing with our research and working with hospital systems is more systemic interventions, where something can be changed in the system, in the process of providing services that could have a greater impact on moving people more timely through their services.
So finally, what are some major takeaways that you have for those trying to follow in your footsteps and create community-based solutions for problems in their local area?
Well, the Red Alliance method or model, as we call it, is to be collaborative and to establish partnerships so that we can collectively address what the problem is. And along with that, what we've employed is trying to bring in the community also. We really believe to bring true solutions, long-term solutions to these problems, there has to be a community component too. Not only just educating the community, but helping the community to be part of the solution. Because the services that are being provided are to those people. And so if they can tell us what would work best for them, then they're more likely to take advantage of whatever systems, are put in place. So, for instance, last summer, we held a series of town hall meetings in neighborhoods, had women come out and talk to us about what their experiences have been to try to find out if there are things that are happening, along the continuum of care in their experience that could be contributing to the disparity. So we heard things like, I don't go to the doctor because I don't think, if I'm diagnosed, I don't have the resources, I don't have the money, I don't have the insurance to get treatment, so I'd rather not know. And we heard things like, well, I don't know my family history because, my family doesn't really talk about that. So when we hear things like that tells us maybe where we need to do some education. It also tells us that if it's a issue of knowing where to go or resources, we have to make sure that women know that there are resources there. You don't have to think that because you're diagnosed, there are no answers for you to get services. But again, it takes not just Gennesaret or not just IU Medical Center to come up with those solutions. I think it takes a collective effort. So everybody's sort of on the same page and everybody's contributing wherever they can. For instance, Gennesaret has, I know I'm biased because this is my work and my employer. I think Gennesaret has a great program, but we're a small program, so we can't serve a lot of people. So even if we think we have some great practices, what we want to try to do is share those practices with other organizations that might serve more patients and say, how can what we do, how can you kind of adapt that to what your system is, and so you can move people more efficiently through that continuum of care.
And where can our listeners find more information and be kept up to date on the happenings of the Red Alliance?
For the Red Alliance, the best way is to follow us on social media. And so it's for both Facebook and Instagram and Twitter. Our handle is just Red Alliance Indy. We are working on a website, so that will be up hopefully soon, as well as an app, which we're kind of excited about. So they can find us there. Also, if anyone wants to communicate with us more directly, our email is redallianceindy@gmail.com. And our phone number is 317-426-9384. So those are the best ways to find the Red Alliance.
Awesome. Thanks for being here.
Thank you.